In today's changing healthcare environment, patients are choosing to take a proactive role in making decisions regarding their medical needs. In the case of blood transfusions, concerns about blood product safety, supply shortages, the cost of transfusion therapy has meant that physicians and patients may seek medically acceptable alternatives to blood transfusions. What options are available at Abington Memorial Hospital?
So, doctor, what are my chances of needing a blood transfusion with this type of surgery?
Well, that's a good question. Well, while the likelihood is not high, there is, however, always the potential for significant blood loss in this type of surgery.
Well, if possible, I definitely want to avoid getting somebody else's blood. And in addition to that, though, I also have some concerns about blood safety. What would be my options?
Some patients choose to pre-donate their own blood prior to surgery. Also at Abington Memorial Hospital, we could direct you to our Center for Bloodless Medicine and Surgery, where we can also inform you of acceptable alternatives to taking a blood donation.
It's wonderful. That sounds like exactly what I need.
Okay, well, I'll set up a consultation for you with Bloodless Program Care Coordinators.
That sounds great.
When I met with the Bloodless Program Care Coordinator, I was truly amazed to learn of the many blood-conserving methods that, when used in combination, can reduce or even eliminate exposure to donated blood. I never knew it.
My doctor recommended the use of the Cell Saver machine during my surgery. It collects your own blood from the surgical site and it returns it to your own body, preserving your own blood. What a great service.
Since I was having major surgery, I was referred to a hematologist. This doctor prescribed to me medication, vitamins, and iron to build up my blood count prior to surgery. My blood count did improve, and this was a key factor in me avoiding blood.
The Bloodless Program Coordinator helped me to make the proper decision on alternatives as far as blood is concerned. They made me feel at ease, and at the time, I really needed that.
On the day of my surgery, I was met by a care coordinator who at that time, in the pre-op area, who at that time gave me a special armband, and then a no blood sticker and other forms were put in my file, which made me feel very confident that my wishes would be respected. And on top of that, every day when I was in the hospital, they visited me.
I would recommend this service to anyone wishing to reduce or maybe even avoid altogether the possibility of receiving a blood transfusion.
As a physician, it's very satisfying to provide patients with the best care possible while respecting their specific wishes.
Thank you, Abington Memorial Hospital, for providing the Bloodless Medicine and Surgery program.
If you or someone you know may be interested in our Bloodless Medicine and Surgery program, please talk to your doctor or contact a care coordinator at 215-481-7400 or toll-free at 1-866-441-6763.